Hello, today we will be going through the bones. Okay, so bones made of osteoblasts, bone lining cells, osteocytes, and osteoclasts, and all of those have a role in cell modulation. And the extracellular matrix is made out of organic compounds and inorganic compounds. The extracellular matrix organic compounds include type 1 collagen fibers, glycosaminoglycan, proteoglycans, adhesive glycoproteins such as osteonectin and osteocalcin. It's secreted by the osteoblasts. They make osteoid, which is the uncalcified component of the bone matrix, which is immature bone tissue. And then the inorganic compounds is calcium phosphate, hydroxyapatite, bicarbonate, citrate, magnesium, potassium, and sodium. Osteoblasts originate from mesenchymal stem cells, and those differentiate into osteoprogenitor cells. They're polarized cells, which means like the cytoplasm is usually oriented towards the bone, while the nucleus are away from the bone. It's located on the surface of the bone matrix, and the osteoblast will secrete the matrix compound at the cellular surface in contact with the existing bone matrix, and that will produce the osteoid. And process of bone appositional growth is completed by the subsequent deposition of the calcium salts into the new matrix. Active osteoblasts are small and cuboidal and mononucleated cells, and they are forming just one layer. They are joined by adherent junctions and gap junctions, and they have basophilic cytoplasm, abundant ribosomes, and secretory vesicles. They have a well-developed rough endoplasmic reticulum, a perinuclear halo, large Golgi apparatus, and a large nucleus. They make alkaline phosphatase that is needed for the mineralization of the osteoid. And elevated levels of ALP seen in like the Paget's disease of the bone, which that will indicate excessive osteoblast activity. So the bones will be very thick and very dense. Well, here they are. There's no osteoblasts here, and here they are right here, cuboidal, doing their work, secreting the osteoid. Osteoblasts don't divide by mitosis. Once the synthesizing activity stops, some will go into apoptosis, and others become the bone lining cells, or osteocytes. And the bone lining cells are quiescent, flat-shaped osteoblasts, and they cover inactive bone surfaces. Okay, so Paget's disease of the bone is also known as osteoitis deformans. It's chronic and usually manifests in people who are over the age of 50. And this is when the osteoclasts are more active than the osteoblasts. So the osteoblasts will try to keep up, but the bone is going to be abnormal and malformed. So the osteoclasts are a little bit more active, and the osteoblasts will overcompensate. The bones are large and dense, but they're weak and brittle because and the osteoblasts are just in a hurry and they just kind of slap down any old bone, right? And usually the long bones, the spine, and the pelvises are mostly affected. Bone pain is the most common complaint, and other symptoms include fatigue, weakness, loss of appetite, abdominal pain, constipation, and you can treat this with bisphosphate. And look at these scans. Look how like marbleized this bone is compared to this. Like here it is in the pelvis. Here's another scan. Look how dark it is compared to the other bones. Here, 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 here. Even a little bit here. But like in comparison, look at the knees. Okay, so bone lining cells, they line the bone, and they are connected to each other by gap junctions. They have a flat or slightly an oval nucleus, and they have very few organelles because they're quiescent. And the processes will extend into the caniculi and connect to osteocytes via the gap junctions. And then the secretory activity can be reacquired, and they prevent the direct interaction between the osteoclasts and the bone matrix where bone reabsorption is not supposed to happen. They might be involved in the propagation of the activation signal that initiates bone reabsorption and bone remodeling. So here's the osteo, like these are the inactive, and then once this is active, this might mediate. Okay, so osteocytes lie in the lacuna of the lamellae. They are mature and inactive cells. They don't have too much of the ER, and they have smaller Golgi complexes. And their chromatin is generally condensed. They have low alkaline phosphatase activity, and they're the most abundant cells in the bone. And these are quite long-lived. They can live up to 25 years. The cytoplasmic processes will extend into the caniculi, and they have the gap junctions that pass nutrients and metabolites from the blood vessels. These also don't divide by mitosis, and they maintain the calcified matrix. Once they die, the matrix is reabsorbed, and their role is to really sense the mechanical stress of the bone and send signals to the active bone cells to either, if you're working out, that's quite a lot of mechanical stress, and these cells will respond and send the signals to osteoblasts to put down another layer of bone. And a lack of exercise and absence of gravity will make the bone lose their density because there is no mechanical stimulation. So what's kind of important to know, for women, it is really recommended that women should be lifting weights because that will stimulate the bone cells to really like increase the amount of density. So like taking calcium supplements is useful, but in order to really like sequester the calcium and like use it appropriately, one needs to stimulate these cells in order for the appositional growth to occur. Osteoclasts are largely motile, terminally differentiated cells, so once they have differentiated, that's it, they're not going to be anything more. They are multinucleated, and they originate from the hematopoietic progenitor in the bone marrow. They sit in something called the house-shaped lacuna after they have eroded the bone. They are eosinophilic and highly vacuolated when active. They have lots of mitochondria, and they have a sealing zone or a clear zone, which is a ruffled air border that's directly in contact with the bone matrix close to the house-shaped lacuna. Here's the house-shaped lacuna. And the basolateral domain is a functional secretory domain that is not in contact with the bone matrix. So here it is. The reabsorption will involve the rearrangement of the actin cytoskeleton and the formation of an actin ring. The sealing zone is an area of no organelles and is made of the actin ring and the proteins. Here's the sealing zone. And integrins will tightly bind here the cell to the non-collagenous bone matrix, making a peripheral seal that isolate the ruffled border from the surrounding tissue. Why? Because the ruffled border is going to secrete a bunch of enzymes that will degrade the bone. So the secretory domain is up here. This is going to be the basolateral membrane, sealing zones right here, along with like actin rings here and the integrins. The ruffled border is a membrane domain formed by microvilli. It contains the ATPase and the lysosomes, and this is where like protons and acidic enzymes are going to be secreted into this like house-shaped lacuna. The acidic enzyme, like in particular, peroxide, actually comes from the mitochondria. The acidic environment of the house ship lacuna will dissolve the hydroxyapatite, and the secretion of the proteolytic enzymes, collagenases, and nonspecific MMPs will degrade the non-mineralized collagen matrix. The breakdown products of the collagen fibers and the other polypeptides are endocytosed across the ruffled border and then further degraded in the lysosome. And then all the calcium and other ions are released directly to the nearby capillaries and enter the blood. So here's the pre-osteoclasts. Once they're activated, they become the active osteoclasts, and then this is going to be the reversal when mononuclear cells will kind of like displace them. Pre-osteoblasts will come in, osteoblasts will form, will differentiate, and then they will sit in the house ship lacuna and then deposit the osteoid and then like migrate inside and stay there as osteocytes or go through apoptosis. Osteoclast activity is indirectly stimulated by the parathyroid hormone and it responds to calcium levels. It's directly inhibited by calcitonin. Osteopetrosis is it's a rare genetic disease characterized by dense, heavy bone where reabsorption is defective and the bones look marbled. Osteoclasts won't have the ruffled borders, and there's a mutation in the gene for the proton ATPase pumps or the chlorine channels. So there's going to be increased density, cortical thickening, and obliterating marrow cavities because there's just too much. It's going to be too much bone deposition, so the marrow cavity will get like smaller and smaller, and then that will lead to a problem with hematopoiesis because that's where all the cells are formed. So here's the stimulation: a micro damage or change in mechanical stress, activating the osteoclast progenitors. There's the bone, and then reabsorption, osteoblast formation, and then mineralization. Compact bone is made out of the Haversian systems. It's found in the ends and the diaphysis of the long bones, the internal and external surface of the flat bones, and the thin layer around the spongy bone, and the surface of irregular and sesamoid bones. The function is to provide mechanical strength and protection. Trabecular bone project from the internal surface of the compact bone into the bone marrow cavity. It's only a few cell layers thick, and it's oriented along the lines of stress. They're separated by intercommunicating spaces, and they're all filled with red bone marrow. This is where like hematopoiesis occurs. Irregular lamellae form from anastomosing plates, and they don't contain complete osteons. Trabecular bone is found in the flat bones and the epiphysis of long bones, the interior of irregular and the sesamoid bones. In the elderly, the red bone marrow is going to be replaced with the fatty yellow marrow. Lamellar bone makes the adult compact bones and is made of secondary osteons, and they form in concentric circles, layers around a Haversian canal, and they are made out of sheets of mineralized matrix containing type 1 collagen. And then the outer boundary is the cement line, which is evidence of previous remodeling, results from bone remodeling, and it marks the limit of reabsorption. So you can't go past that limit, right? Once the osteoclasts are working. Primary osteon is the lamella around the Haversian canal. That doesn't replace the old bone, and cement bone is not formed. Lamellar deposition starts from the periphery, so younger lamellae are closer to the center of the system. So in the appositional growth, it grows inwards, right? And then interstitial lamellae are incomplete or fragmented osteoins. and osteons. I'm sorry. They represent the remnant osteons left from partial reabsorption from the old osteons during bone remodeling. And there's an external and inner circumferential lamellae. The younger bone has more complete osteon and less interstitial lamellae, so there's less lamellae to break up the osteons. So the lacuna have one lacuna, and they lie between the lamellae. The caniculi will connect the lamellae, and the Haversian canal is lined by the endosteum, and it contains the blood vessels, lymph vessels, nerves, and loose connective tissue. Volkmann canals are transverse canals, and they provide channels for neurovascular systems and for the Haversian canals to communicate. Woven bone is formed during fetal development, and temporary bone is formed during the tissue turnover, is replaced eventually by the lamellar bone. The bone matrix mineral content will I'm not sure what that was there. Bone deposition is going to be faster than lamellar bone, and collagen fibers are going to be all over the place in the woven bone, irregularly oriented. Osteocytes are going to be embedded into the bone matrix, and these generally reside around blood vessels that are going to be penetrating the bone surface. After birth, it's near the sutures of the flat bone of the skull, along with the tooth sockets and the insertion sites of some tendons. And in adults, it only occurs during fractures, fracture repairs, tumors, and infections. The periosteum is the external covering of the bones, except for where the tendons, ligaments, and the muscles attach. The outer layer is going to be a dense, irregular connective tissue, and that contains collagen and reticular fibers, along with fibroblasts, vessels, and nerves. And then the collagen fibers are going to be continuous with the joint capsule, the ligaments, and the tendons. Sharpie's fibers are bundles of collagen fibers that penetrate the bone matrix, and they strongly adhere the periosteum to the bone. And the inner cellular layer is very cellular because that's the site of hematopoiesis. The osteogenic layer will contain the bone cells, bone lining cells, the osteoblasts, and the osteoprogenitor cells. It forms a dense networks of lymphatics and blood vessels and sensory nerves. And it plays a role in bone nutrition, remodeling, regeneration, and appositional growth. Endosteum, it lines the inner surface of the bony trabecula and the wall of the bone marrow cavity and the Haversian canals. It's made out of a thin, loose, irregular connective tissue, and it contains osteoprogenitor cells, osteoblasts, bone lining cells, and those all arranged in a single layer. The bone nutrition, appositional bone growth, remodeling, and regeneration, and that's what it is involved with. That's it for now. Thank you for all your attention, and good luck studying.